Yeah, you can call me Deepak if it's
Okay,
easy.
Deepak I can do.
Yeah.
You know, and you're a cardiologist, you're an interventional cardiologist. What's interventional cardiology?
So interventional cardiology, it's a subspecialty of cardiology where we treat patients who come in with blood circulation related issues.
Oh.
So the classic example is acute heart attack. So we treat those patients, and that's basically what interventional cardiology is. That's one subset. So the other part that we do is we treat patients who have structural heart disease. For instance, if the valve is tight, we see if that is something that can be replaced or repaired without cutting open the chest.
Ah, nice.
And there is other aspect to it, or the other part to it, which is peripheral intervention, which is my specialty as well, where we treat patients with blocked arteries in the legs. So what we call as the claudication.
So where Dr. Nanjundapa was more of a preventative type, you're more of once the disease is there, you're doing the treatments for it.
Yeah, so actually Dr. Nanjundapa is also an interventional cardiologist.
Okay.
So I think one advantage that we get as interventional cardiologists is we get to see the actual disease burden, how bad the arteries get with the lifestyle choices, with the poor lifestyle choices. So I think that's when we see or we wish this patient could have done something preventative 5 years ago, 10 years ago, and we didn't have to see this patient on the cath table getting a blocked artery open. So that's where I think we get to see the worst possible scenario. That's the reason we say, okay, so is there anything that could have been done a decade ago or like 5 years ago?
Do you see anything, I presume it's a combination of lifestyle and genetics. Do you see anything in particular communities where genetics or lifestyle are playing causing more cardiac troubles?
Yeah, definitely. So when you look at the United States of America, so you see it is represented by people from all over the world. So when you see that small minority, especially Indians, the Asians or Chinese, Pakistanis, or somebody from Nepal, the problem with us, when I say us, the problem with the Indian subcontinent is we, for some reason, have smaller sized artery and we have a higher disease burden when compared to the same aged patients in this country. So that's the reason there is that big difference between the two population. So for instance, if you take a 40-year-old white male and compare it to a 40-year-old Indian male, the chance of us having slightly worse disease are higher.
That's something, and you know, there's so much someone can do though, and
True.
and the sooner the better. Obviously, you
True.
said 5-10 years ago,
Yeah.
you can't go back in time, but
That's true.
both of you today are scaring me, and I'm going to try to make some changes right away.
It is not about scaring, it's about giving them an opportunity. And my motto is, you save one life, you save a family. Because I have had very close encounters with my friends whom I wish I could have saved, but they had such bad disease I couldn't save, and next thing you know is it has affected the family. So that is something that we don't often, that goes unnoticed. So treat a person, you will treat a family.
I remember a long time ago, a friend of my father was a cardiologist, a Euclid General, and he was always complaining when he had an obese person. He says just physically, so much more difficult to go in and layers of fat and to pull through and all that. It's obviously you see that.
Yeah, there are challenges. There are challenges that come with our lifestyle. And as I said, if you see primary care provider or if you see the specialist, at least they can identify it at an early stage so that they can prolong their life. They can prevent disability.
All right, well, this is great information, Deepak. We appreciate it, and we're going to make sure our South Asian viewers see this, but it's also a great message for all of us here. So thanks for talking to us today.
Thank you so much.